While I welcome best practices, I want it a coordinated approach. I want an EU mental health strategy. I want every EU minister dedicated to mental health here, be it in Strasbourg or Brussels, to sit down and actually figure this out, because ultimately it's our future generations that are at risk of continued death by suicide.
The EPP Group's Maria Walsh on the European Commission's new mental health strategy and the urgency to act.
I think an EU mental health strategy that specifically also deals with the world of work in the ever-changing of digitalisation needs to be built in.
More than 150 million Europeans live with mental health conditions, while every day 3 lives are lost to suicide among Europeans aged 10 to 19.
Tak je potřeba zmínit, že to byla Evropská lidová strana, která byla první, která navrhla, aby byla nějaká strategie Evropské unie k mentálnímu zdraví. A je potřeba v současné době opravdu být ambiciózní.
Brauchen wir eine 360-Grad-Betrachtung, weil es ist ein Mehrebenenproblem. Häufig kommen ja viele Dinge zusammen, Betreuungssituationen Kinder oder pflegebedürftige Eltern, Probleme auf der Arbeit, Probleme in der Partnerschaft, teilweise aber auch Einsamkeit.
Of course, this communication is a step in a good direction, but I think we have to go more in depth and see what we can do on European level to improve mental health of our citizens.
The EPP Group wants the EU's mental health strategy to break through barriers to dealing with it.
We have to fight the stigma that is associated with mental health. We should involve medical doctors, scientists, professionals to explain that there is no need to have such a stigma. So we should put mental health and caring about mental health on the same level as caring about physical health.
And make help more accessible through a helpline.
There is no reason why we can't be bold and ambitious and having a dedicated mental health line. Can you imagine? I'm sitting in Hungary, in Budapest. I see the amount of disinformation about my sexuality out there. I'm coming from Ireland and I'm studying veterinary, which a lot of our students do. And I know that there's a dedicated line that I can go to find instant support in a language that I understand. Think of all the lives we save with that.
What is crucial is that mental health patients and people suffering from mental health issues are not second-class citizens. I would especially like to address the mental health of young people. I think that's a major issue. This has proven to be the case, especially because of COVID-19 pandemic, but also when we look at the influences of social media as well, we see that definitely this also impacts the mental health of youth.
Mental health affects families across the European Union. That's why it's time to talk about it.
Osobně mám příběh z vlastní rodiny, kdy mám staršího bráchu, který se neprobudil z narkózy. On sám je několik let léčen právě kvůli duševnímu zdraví a kvůli jeho pohodě. A tady je potřeba říci, že sám vidím, jak je potřeba tyto lidi integrovat do společnosti, nabídnout jim normální způsob života.
Wir haben jetzt die letzten Jahre multiple Krisen erlebt und wir lösen diese Probleme nicht, indem wir die Augen davor verschließen.